get a sudden ping from your partner. The oximeter just flashed 82. Your heart races, you call 911 until you realize the finger was cold and the little clip was hanging off the nail. I once had a patient tell me the same story. Terrified, convinced they were crashing, but the device had been misread. That minute-long panic could have been avoided with 3 quick checks. Today, I want to give you those checks and the exact words to say if you need help. Let's separate medical fact from fiction.
Hi, I'm Nurse Jessica Tanya. I work on the front lines of family medicine and emergency nursing. And on this episode of FAQ by Nurse Jessie, I'll walk you through oximeters, home blood pressure cuffs, and glucose meters, what they actually measure, what they don't, how to validate them at home, and conservative action rules that tie numbers to symptoms. Quick note, this episode is educational and not a substitute for your clinician's advice. If you're ever having severe symptoms, trouble breathing, chest pain, fainting, call emergency services right away, regardless of any device reading. The full transcript and downloadable tools are linked in the show notes, and there's a 1-page multilingual cheat sheet if English isn't your first language.
Before we dive in, here's a short practical take from a biomedical engineer I consulted. Devices are designed with limits. Validation means a device has been tested against clinical standards under certain conditions. Consumer-grade gadgets may be fine for trends, but not for critical decisions. Calibration, firmware, sensor placement, and environmental conditions all change the number you see. Treat home monitors as one piece of information, not the whole story. Okay, back to specifics. What does each device actually measure? Pulse oximeters use light absorption to estimate oxygen saturation and pulse. That number is an estimate and can be affected by motion, cold fingers, nail polish, and skin pigmentation. Blood pressure cuffs measure pressure in your arteries indirectly. Cuff size, arm position, and whether you're talking or moving change readings. Glucose meters measure capillary blood glucose from a finger stick, but strip storage, expiration, and hematocrit can change accuracy. Selection criteria: look for devices that are validated or cleared by a regulatory body in your region. Check peer-reviewed validations when possible, and avoid thinking price equals accuracy. I won't endorse brands here. Look for validation data in the product information and check that cuff sizes and test strips match your needs.
Common error sources and fixes. First, fit and placement. For oximeters, place it on a warm, clean finger and sit still. For BP cuffs, use the correct cuff size on bare skin at heart level. Sit quietly for 5 minutes before measuring. For glucometers, check strip storage. Keep them sealed and dry, and don't use expired strips. Batteries, dirty sensors, and outdated firmware can cause drift. If you use a cuff, make sure clothing isn't under the cuff and support your arm. If you see a wild outlier number, don't panic. Recheck using the right technique and repeat once or twice. How to validate at home. Do a clinic compare test. Bring your device to a clinic visit and ask to compare readings to the clinic equipment. Use the repeat measure technique at home. Rest 5 minutes, sit quietly, take a reading. Wait 1 minute and repeat. Take a third reading if results vary. Document the time of day, activity before the reading, and whether you were sitting or standing. If you're tracking trends, always measure the same way. If your device consistently differs from clinic values beyond the manufacturer's stated margin, it's time to replace or recalibrate.
Now, probably the most useful part for many listeners, symptom plus number interpretation. Numbers alone can mislead. If you have severe symptoms, hard time breathing, new chest pain, fainting, severe weakness, call emergency services immediately, no exceptions. For oximeters, a conservative approach I use in practice: if your saturation is under 92 and you have breathlessness, call your clinic now. If it's under 88 or you have marked breathlessness or blue lips or confusion, call emergency services. One-line scripts you can say, "My oxygen is 88 and I'm short of breath. I need urgent advice." For blood pressure, very high readings, systolic over 180 or diastolic over 120, with symptoms like headache, chest pain, or visual changes, warrant emergency care. Script: My blood pressure is 188 over 122 and I have a severe headache. What do you advise? For low glucose, use the meter number plus symptoms.
If glucose is under 54 milligrams per deciliter and you're confused or unable to swallow, call 911. Script: my glucose is 48 and I'm confused. I need emergency help. Special populations need extra caution. For children, thresholds differ and interpretation must include behavior. If a child is pale, unusually sleepy, or hard to wake, seek care regardless of device numbers. Don't rely on adult cutoffs. Say to a clinician, my child's oxygen is X, but they're sleepy or poorly responsive. I'd like urgent advice. For pregnancy changes physiology. If you have symptoms or numbers outside what your obstetric team has told you, contact them directly and use language like, I'm pregnant. My oxygen, BP, glucose is X, and I'm experiencing symptom. What should I do? For arrhythmias, oximeters can misread during irregular pulses. Bring readings to your cardiology team and say, I had these readings during palpitations. Can we review them? Low resource alternatives. If you don't have a device, use symptoms first rules and seek timely clinical assessment. Community clinics and pharmacies may offer spot checks. Micro quiz, 30 seconds. Grab your device and answer these 3 checks right now. 1. Is the sensor or cuff on the right body part and sized correctly? 2. Did you rest 5 minutes and sit with the limb at heart level before reading? 3. When you repeated the measure, were the values within a small range or wildly different? If you get any no answers, pause and follow the fixes we covered. This quick checklist is in the show notes as a printable one-liner. Recording and sharing trends. Clinicians want context. When you document readings, include date, time, activity before the reading, body position, and symptoms. Taking a photo of the device screen with a timestamp and a note, resting, seated, 10 minutes after medication, can be very helpful. Keep a simple log with columns for date, time, device value, symptoms, and any actions taken. If you share data via a portal or voice message, anonymize sensitive details where possible and follow the privacy guidance on our show notes. Scripts and templates. Here are short, clinician-ready messages you can copy. For a portal message, hello, my home oximeter reads 90 at rest this morning. I am short of breath when walking to the mailbox. Can you advise next steps? For phone triage, my blood pressure is 180/110 and I have a pounding headache. Should I come in or go to urgent care? For urgent 911 language, my oxygen is 85 and I'm very short of breath. I need an ambulance. Keep messages factual, include symptoms, and avoid interpretations like I'm dying. Say what you see and feel so clinicians can act quickly. Device care and buying tips. For BP cuffs, ensure the cuff size matches your arm circumference. Measure the midpoint of your upper arm and check the manufacturer's sizing chart. For glucometers, store strips in a cool, dry place. Close the vial tightly and replace the vial cap each time. Replace oximeter batteries promptly and clean sensors per the manual. Test strips and batteries have expiration timelines. Write the open date on the container. When buying, prioritize documented validation, correct accessories, extra cuffs, compatible strips, and local regulatory clearance information listed in the product details. Accessibility and resources. Everything I mentioned today is in the show notes. Full transcript, a downloadable log template, a clinician-ready summary you can hand to your doctor, and the multilingual one-page cheat sheet. If you want to send a question or a voice note, there are secure links in the episode page. Please anonymize personal details before submitting. We also link to third-party validation studies where available, so you can check a device's data yourself. Okay, before we close, here's how to use this episode in practice. First, validate once by clinic comparison, and then use consistent measurement technique. Second, always tie numbers to symptoms. Numbers alone don't tell the whole story. Third, when in doubt, use the exact scripts we practiced to get timely clinician advice or emergency help. Those are your 3 takeaways. If you found this episode useful, download the log and cheat sheet from the show notes and subscribe so you don't miss future episodes. You can also email or leave a secure voice question on the episode page. Anonymize personal info first, and we'll answer on the show when possible. Thanks for spending this time learning practical, safety-first ways to use home monitors. Until next time, stay informed, stay compassionate, and always put safety first.